What is Colesevelam Welchol? Colesevelam, also known by the brand name Welchol, is a prescription medication used to lower levels of bad cholesterol, LDL, in the blood. It's approved for use in adults and in children as young as 10 years old who have high cholesterol due to genetic causes. In addition to its cholesterol-lowering benefits, Colesevelam is also prescribed to help control blood sugar levels in adults with type 2 diabetes. For best results, Colesevelam should always be taken as part of a comprehensive treatment plan that includes a healthy diet and regular exercise. The medication is typically taken once or twice daily, as directed by a healthcare provider. Common side effects may include constipation, bloating, and indigestion. What is Colesevelam used for? Colesevelam Welchol is used as an add-on treatment to diet and lifestyle changes for reducing high cholesterol hyperlipidemia in adults, lowering high cholesterol in children and adolescents aged 10 to 17 years who have familial genetic high cholesterol, improving blood sugar control in adults with type 2 diabetes. How does Colesevelam work? Colesevelam belongs to a class of medications known as bile acid sequestrants. It works inside the intestines by binding to bile acids and preventing them from being reabsorbed into the body. This process forces the liver to use more cholesterol from the bloodstream to produce new bile acids, which in turn lowers overall cholesterol levels. In patients with type 2 diabetes, Colesevelam can also help reduce blood glucose levels. Although the exact mechanism isn't fully understood, it's believed that Colesevelam increases levels of a natural hormone called glucagon-like peptide 1 (GLP-1). This hormone stimulates insulin release, helping the body regulate blood sugar more effectively. What are the side effects of Colesevelam Welchol? Like many prescription medications, Colesevelam Welchol can cause side effects. Most are mild and may improve as your body adjusts to the treatment. However, if these effects persist or worsen, it's important to contact your healthcare provider. Common side effects of Colesevelam include constipation, reported in about 11% of users, indigestion or bloating 8%, nausea 4%, fatigue or general weakness 4%. Other possible side effects: sore throat or nasal congestion, flu-like symptoms, runny nose, muscle aches, accidental injury such as strains or sprains. Serious side effects: seek immediate medical attention if you experience pancreatitis. Inflammation of the pancreas. Symptoms include severe abdominal pain that may radiate to your back, nausea and vomiting. Gastrointestinal complications, such as severe constipation, abdominal pain, or blood in your stool. If you notice any unusual or persistent symptoms while taking Colesevelam, inform your healthcare provider right away. Colesevelam Welchol, dosage forms and cost. Colesevelam is available in both tablet and powder for oral suspension forms. The average retail cost for 60 tablets of 625 milligrams is approximately $113.07, but with a GoodRx coupon, prices can drop to around $25, representing a savings of nearly 78%. Typical dosing for Colesevelam Welchol. Tablets. The recommended total daily dose is 3.75 grams, taken either as 625 milligrams tablets once daily or 3 625 milligrams tablets twice daily. Powder for oral suspension. The standard dose is also 3.75 grams daily, taken as 1 3.75 g packet once daily or 2 1.875 g packets twice daily. Important administration tips. Colesevelam Welchol should always be taken with food and a full glass of water to improve effectiveness and minimize stomach discomfort. Colesevelam Welchol. Contraindications. Certain health conditions can make Colesevelam Welchol unsafe to use. Contraindications are specific medical situations where the risks of taking this medication outweigh the potential benefits. If any of the following apply to you, inform your healthcare provider before starting Colesevelam. Do not take Colesevelam Welchol if you have blood triglyceride levels greater than 500 milligrams per deciliter, a history of pancreatitis caused by high triglyceride levels, a history of stomach or intestinal blockage. Always disclose your full medical history and any ongoing health issues to your healthcare provider before beginning Colesevelam therapy. Pharmacist tips for taking Colesevelam Welchol. 1. Keep up with follow-up appointments. Mark your calendar to stay on track with medical visits and blood tests. Your healthcare provider will monitor your cholesterol and blood sugar levels regularly to ensure Colesevelam is safe and effective for you. 2. Take Colesevelam with meals. Always take Colesevelam Welchol with food and liquid, ideally at the same time each day, to maximize absorption and minimize stomach discomfort. 3. How to take Colesevelam powder packets. If you're using the powder form, empty the contents of 1 packet into a cup. Add 4 to 8 ounces, about half a cup to 1 cup, of water, fruit juice, or diet soda. Stir well until completely mixed and drink the entire mixture right away. 4. Prevent constipation. Constipation is one of the most common side effects of Colesevelam. You can help prevent it by eating more fiber-rich foods such as vegetables, fruits, and whole grains. Drinking plenty of water throughout the day. Staying physically active. If constipation becomes bothersome, you can ask your provider about safe over-the-counter options such as bismuth subsalicylate, Pepto-Bismol, docusate, Colase, or polyethylene glycol, Miralax. Always check with your healthcare provider before taking any new product. 5. Watch for drug interactions. Colesevelam can interfere with how other medications are absorbed. To minimize this risk, take your other medications at least 4 hours before Colesevelam, Welchol. Your pharmacist or provider can help you create a dosing schedule that works best for you. 6. Maintain a heart-healthy lifestyle. For Colesevelam to work effectively, it must be paired with a balanced diet and regular exercise. Aim for a diet low in saturated fat and added sugar, and engage in consistent physical activity. Consult your healthcare provider for personalized nutrition and fitness guidance. Colesevelam, Welchol, is an effective medication for lowering cholesterol and controlling blood sugar in type 2 diabetes, but it's not suitable for everyone. Taking it correctly, and maintaining healthy habits, is essential for achieving the best results. Always work closely with your healthcare team to ensure safe and effective use. If you found this video helpful, don't forget to like, subscribe, and share it to help others learn more about safe and effective cholesterol management. For more trusted, science-backed health information, stay tuned right here on HeInfo, your reliable source for professional healthcare education.